latissimus dorsi. All right, so flipping over to the medial aspect again, always make sure you're on the same limb you were on before, because when you rotate, it's easy to get lost. I think that this rat's a little bit too shy about her regions for our purposes. So I'm going to make her a little less discreet. And we can begin to see some of our muscles right in here. Now, some of you have started working in this area. If you're having a hard time getting in there because the abdominal wall is in your way, right? Take a pin, stick it right in there like that. There we go, like that. And that way you can see everything, and you've got your hands working at dissecting. You're not trying to hold back with one hand and dissect with the other. So as we come in here, actually there's a little bit of fascia left to clean in here, so very quickly. This stuff comes off very quick and easy. But right along here, we have the border of this muscle. That's our gluteus superficialis again. And here's an odd looking little muscle. Everything else is going out towards the knee, but this one's going from the hip down towards the crotch. It's going in a different direction entirely. Actually, I don't know if you can see that.
Oh.
So right there, this muscle is running a different direction than everything else. That's the muscle I mentioned with sit-ups in class. That's the iliopsoas. See that right there now? Iliopsoas, there's our gluteus superficialis. And now over here, there's really only two muscles we're looking for. Let's clean this up a bit. And a lot of this, what we're going to do is basically just removing the fascia attaching the blood vessels to the underlying muscles. You've got to be very careful because you want to save these blood vessels. This is the easiest stuff on the third exam. So if you save it, it'll be tagged on the third exam. If you don't, I'll have to find harder blood vessels to tag on the third exam. So just be very careful as you do that, especially in your animals. Some of your animals aren't well injected, and that's no excuse. You're still going to save those blood vessels. And of course, keep in mind, I'm doing this faster than you would because it's not my grade. If something goes wrong, it has no effect on me at all. You might want to be a little more careful. All right, so basically now we can see there's our vastus lateralis, and on the other side of the blood vessel, all this is gracilis. And again, the gracilis looks like multiple muscles there. So you got to be careful not to fragment it and give yourself more to study, in effect. All right, so pulling up on the gracilis here, and of course keeping an eye on that blood vessel as we go, we can begin cleaning the fascia away from the shin. Trying not to get in the way as I do this.
Yeah, great job.
I just feel weird having my back to the class. It makes me think of the Catholic Church before the 60s.
We're not complaining.
I know. You don't have that glare off the forehead. And I don't have to see beard train gone awry. It's a win-win for all of us. Someone got music going?
No.
Oh, that was you. All right.
Tomas's
Squeaking. So here we can see the gastrocnemius again. Really nice, big, powerful calf muscle. So we lift up on it. You can see that shadow. That tells us where we go underneath to separate it away from the rest of the fascia. And there underneath, we can see our soleus, partially fused to the gastrocnemius, but also partially separated off. It's gonna be hard to see on such a tiny little animal as a rat, but the gastrocnemius and the soleus have a different fiber pattern. The soleus has a distinct bipinnate fiber pattern. So when you see that, it's easy to tell the muscle apart. This little white thing here is a nerve. It's a branch off the sciatic nerve. There are two branches off the sciatic that we're gonna see. The common peroneal, which will be on the lateral aspect of the shin, and this one is the tibial. Okay, so a little extra layer of fascia here to clear off. This is really close to everything, so you gotta be careful. See that difference in color lets you know you succeeded. Alright, so right here we have a muscle. That's our flexor hallucis longus. And then here we've got two muscles. So flexor hallucis longus. This muscle right here behind the tibia, tibialis posterior. Between the tibialis posterior and the flexor hallucis longus, this teeny little muscle in here that's mostly tendon, flexor digitorum longus. We get to the other side of the tibia now. Let's see if I can show this to you without losing too much of the tendon. What I'm going to do here is curve upwards, not losing all the tendon, but a little bit right there, so we can get under here a little easier. There we go. Some of the stuff we kind of almost have to have the animal in an angle as we do it. There's that fascia right there. Oops. With animals as tiny as these, it's a bit of a challenge. So you may have to, again, tie your little guy down so it won't get out of you, won't cause you problems. But again, there's our peroneal tendon. And then here we have two muscles. And you can see the line right there between them. It's the same thing you see in your shin when you raise your foot up. You got that muscle that stands up, that's the tibialis anterior. And over here, next to the peroneus longus, we have this muscle that's the extensor digitorum longus. So tibialis anterior, extensor digitorum longus, tibialis posterior, and flexor digitorum longus. Okay, so that's what you'll be doing on the legs and shins, at least until we go deep, when we'll do a lot more work then.